Welcome to the Gifford Provider Podcast. This is the podcast of Gifford Healthcare located in central Vermont. I'm Scott Fleischman, the communication specialist for Gifford. Gifford is a nonprofit critical access hospital and federally qualified health center with a total of 9 locations. The medical center in Randolph is home to a 24-hour emergency department, inpatient and rehabilitation units, a renowned birthing center, accredited cancer program, advanced diagnostic imaging, surgery, and much more. Go to giffordhealthcare.org to find all the services we provide. My guest for this episode is Gifford licensed drug and alcohol counselor, Jennifer Pelletier. Jen joined Gifford in 2016 and is part of our psychiatry and counseling team, specializing in addiction medicine. Now, before we get into our conversation, if you're watching us on YouTube, don't forget to click the subscribe button, like this video, and tap the notification bell. That way, you'll always know when we have new content for you to watch. On our YouTube page, we have other podcasts, important information from our medical team. We have videos showing why Gifford is a great place to be, not only as a patient, but as an employee. We also feature our Morgan Orchards Senior Living Community, which contains a 49-unit independent living facility and award-winning nursing home. And you can now listen to the Gifford Provider Podcast in your car or while just going for a walk or run. We're on Spotify, Google Play, and Apple Podcasts. So do a search for the Gifford Provider Podcast and follow us and share the podcast with your friends. We also encourage you to revisit our revamped website, giffordhealthcare.org. As I mentioned earlier, you can find a provider, check out the various specialties that Gifford offers, and you can look at all of the locations we have throughout central Vermont and career opportunities. Okay, got that out of the way. Jen Pelletier, thanks again for joining us this morning, joining us here on the podcast. First of all, you've been at Gifford in 2016, but let's go a little further back. Your background in addiction medicine, where did that come from, and why did you want to go into this field?
It started, I did my internship at the Central Vermont Addiction Medicine Hub and Spoke program, which is a methadone and Suboxone clinic in Berlin. And I really enjoyed that work. And I worked at Central Vermont Substance Abuse Services for a few years after that. And then at Central Vermont Medical Center, I always kind of knew I wanted to get into the addiction medicine track from when I was in college. There was a specialty lane we could take and just get a little more education on that front. So I've been, my first day as a counselor, I started working with addiction and I've stuck with it ever since.
And of course, you went to college right here in Vermont, right?
Yes, Johnson State.
So yes, at the time, Johnson State,
Right.
It's gone through a couple of name changes since
Yeah.
then. Talk about that program that Johnson provided you and allowed you to kind of flourish and have that career and stay in the state.
Yeah, it was a great, for me, I went to college a little later. So I never even set foot on campus until I got my bachelor's degree. I did it all remote learning because I was working full time for the state of Vermont at that time. And then continued on with my master's program, doing mostly nights and weekend classes. So it just worked out really well for me. And then being able to kind of do some extra focus on the addiction path so I could have a better understanding of what I was going into, made a big difference for me.
So this was a second career for you?
Most of my careers previously were in administration. I had worked for 7 years at the Vermont Arts Council. I worked in radio for a while. So this was a pretty big deviation from all of that, but I knew it was the right thing when I started doing it. So.
Oh, so I didn't know you had a radio background. This is perfect for you, podcasting. You know what you're doing here. What is it? The connection with people that kind of drove you this way?
Yeah, I mean, I think, and again, with the addiction piece of it, I've had a lot of people in my life who are really close to me that have struggled with addiction. My mother was a guidance counselor, so there's a little bit of kind of counseling history in the family. And so I think I worked in the medical field for a while too in administration. And so just being able to have those connections with people on a daily basis, like that was definitely missing for me when I was working at the state, because I was in an office and I was by myself all day. And so I really missed having that connection and wanted to hopefully be able to try to help some people who are struggling. So
And so again, Gifford since 2016. How did you come to Gifford?
I had been looking for different opportunities. I saw a posting and decided to apply for it. I had a couple of friends who had started working here a little bit before, who had said it was a great place to work. So I applied, and it was pretty exciting because our addiction medicine program was completely new when I came here. So it was kind of like getting to help create this completely new program for Gifford.
I guess you can put that in perspective, small rural hospital like Gifford, how rare is it to have an addiction medicine program such as this in such a small hospital? Is it common, or is it something that, because I feel like with Gifford, a lot of the services we provide, you just don't see that
Right.
in those other small hospitals.
I mean, I don't even know of any other hospitals in Vermont that offer a specific addiction medicine program. So I think it is really unique, and it's a great opportunity for providers to be able to have that direct referral service. And, I think it's also really wonderful for our patients because they don't have to seek services outside of their home network.
So what keeps you at Gifford? Obviously the building the program, for sure, and I mean, like you said, really can't find that anywhere else in a smaller hospital. But what is it? What else is it about Gifford?
Gifford is like a small family kind of place. I feel like, ever since I started working here, people knew my name. I knew other people's names. It's easy to walk around and just recognize everyone, and that's really nice. The patients are wonderful. It's great for me because I live in central Vermont. So we have an office in Berlin as well as in Randolph. So that makes it convenient, and it's nice to be able to kind of work in different areas and serve different populations. And it's just a place where, again, I feel really well supported and have really enjoyed everyone that I've gotten to work with here.
And again, you can check out all of our locations on our website, giffordhealthcare.org. So you came in, you helped start this team, and now you're working with this great psychiatry and counseling team together. What's it been like? What's the dynamic like with this team? We've had Erica Schleif, we've spoken with her before. Um, s- you know, just tell us what that's been like and how each of you kind of complement each other.
I mean, I think we're really fortunate here at Gifford because, we have a psychiatry department that's actually taking new patients, which is pretty uncommon right now. It's really difficult to get psychiatric care in Vermont. Um, in addition to that, we have Dr. Laconis, who handles the addiction side of things. And then it's nice being part of a smaller team because we all are able to communicate with each other. I wouldn't hesitate to call and talk to someone if we have a mutual patient or if there's a concern about someone and just needing to be able to bounce ideas off of someone else. So again, it's a really nice part of being part of a smaller team where we all are trying to support each other and work together.
And how about specifically, you do work with, like you mentioned, Dr. Laconis. Speak specifically of kind of your specialties, his specialties, and how that kind of works together.
Yeah, so Dr. Laconis has a background in psychiatry, but has decided to put his focus strictly on the addiction medicine piece of things. So what he does is he's able to prescribe medications like Suboxone for opioid use disorder, naltrexone, Vivitrol, and then also medications that can help with alcohol use disorder, so Antabuse or Campril. And so he kind of handles that medication side of things. And then for people who need additional support outside of the medications, a lot of them get referred to me for counseling. The medication is an important piece of it, but there's usually underlying issues for people struggling with addiction. It's not just having a physical addiction to a substance. There's usually co-occurring mental health issues or depression, anxiety, trauma. So then people can come in and see Dr. Laconis, and a lot of times we can accommodate it so they can come in and see me right after, so they don't have to make multiple trips. Then if we determine they need other assistance or other medications to help with depression or anxiety, a lot of times we'll refer to the psychiatry department and they can get support there too. So again, it's really nice. It's a small team, but we can all kind of work together and, help kind of balance out what everyone's strengths are.
After I left the military, I missed that feeling of belonging to something and feeling a part of something special. And that's exactly what I got when I came here.
When I first moved up here after college, no one would take a chance on me, and Gifford did. The people here at Gifford, the community members, everybody, it just feels like home.
Working with an administration that you feel like understands you and hears you is a big part of job satisfaction.
There is room to grow here. We're looking for people that are technically skilled and are willing to learn.
You had mentioned that the psychiatry and counseling team, they're seeing new patients. How has the pandemic affected business over the last couple of years? I mean, are we seeing more patients? I mean, you've 2 years of, in some cases, people have just been so alone and isolated, and we've had, the unknown. We've had people get really sick and in some cases pass away, family members, loved ones. So I'm sure you've probably seen that increase.
Yeah, there was actually a study in the Journal of American Medicine that just came out a couple of weeks ago that said that alcohol-related deaths increased by 25% between, I think it was 2019 and 2020. So right during the pandemic. We've definitely seen also an increase in overdose deaths since the start of the pandemic. I believe Vermont opioid overdoses specifically increased by about 38%. And so, we've seen more people seeking help because alcohol use has gone up. I think with people being isolated and being home alone, having downtime, not having to go to work, being stressed with taking care of their kids, but also that idea of I'm not going anywhere. I can't do anything. There's no danger. So I'm just going to stay home and drink. But then people's use increased and to the point where then it kind of became problematic when everything started opening back up again. And then with the substance use, people using in isolation, there weren't people there to give them Narcan that could have saved their life at the moment because they were alone. And, there was also been an increase in fentanyl that's been mixed in with heroin and other substances. So that's contributed to the overdose rates as well.
At what point did you think like this is going to be trouble? I mean, we obviously the main concern was the virus and keeping people from catching it, and we didn't have vaccines, no testing wasn't really, it was in its infant stages. So, the key was just to keep people safe, keep people separated, keep people safe. But at what point did you as yourself, the team kind of think like, this is going to be a problem at some point that is going to, that's going to reflect the numbers you just talked about?
I think Dr. Laconis in particular recognized that very early on. And a lot of what we started noticing was that a lot of other outside places that offered counseling services were closing their doors, or they were only offering virtual counseling appointments via Zoom. And we knew that that was not going to work for people. So rather than shut down or reduce our hours like a lot of other places did, Dr. Laconis actually stayed open 7 days a week at the start of the pandemic for several months. We were working on weekends and trying to be here to offer more hours because we wanted to ensure that people would have access to services.
So let's talk a little bit about the patients. Obviously, I'm not going to go to specifics, but when you talk about drug and alcohol addiction. There can be a certain stereotype of folks, but you probably see a wide range of people, especially nowadays. And with the pandemic, you've had people that just kind of have fallen into this. So talk about that, the range of folks that you do see, and it's not just what people might think.
Yeah, I mean, I think we see people who are very young, under 20, under the legal drinking age, that are already struggling with their alcohol or substance use, all the way up to people in their 70s and beyond that are suddenly struggling, and everything in between. So I think age, it affects people of all ages. You see everything from, every range of career path, or, and so it really impacts everyone. And I think people do kind of have that stereotypical idea of, the bum under a bridge drinking out of a brown paper bag. And that's just not the reality of it. But I think because of that, that's where the stigma comes into play, a lot of times in terms of people seeking treatment or not wanting to seek treatment, because there is that stigma associated that, you're a bad person, or that your life has completely fallen apart, or, you've hit that rock bottom that's bad enough that you have to get help. And I feel like that's not necessarily the case for everyone.
You talked about young people. Are you surprised with the amount of young people that you see? And is that also, I would imagine with the pandemic, that's also increased?
Yeah, I don't personally work with people under the age of 18, so I don't have as many, but I do know that, our counseling and behavioral health department sees younger people, and there is definitely a fair amount of substance use there. It is surprising because I think for, a lot of kids, it's that normal, everybody's doing it type of mentality. But at the same time, I'm also impressed to see some of these younger people who are coming in and seeking treatment at a young age. So they're realizing that it's a problem, whereas, a lot of people kind of figure, oh, it's I'm in my 20s, it's okay, this is what everybody does.
Is a lot of what you see genetic? Is it a family history? I guess genetic might be the wrong word, but a family history where, parents were kind of fallen into addiction and it's trickled down? Do you see a lot of that?
There's definitely a genetic component. I think there's also, I think, a kind of a trauma component that lends itself when you have parents who struggle with addiction and substance use. Sometimes that involves parents who are then incarcerated, which means kids don't have their parents around, which is a certain kind of trauma. You see kids who are exposed to domestic violence in those kind of households sometimes. Poverty, difficulty maintaining jobs. And so I think there's the genetic component, but then I think it's also the trauma that results for kids who have parents that struggle with substance use that I think also lends itself to future substance use in the next generation, because they just don't know how to manage that trauma. And if they have parents who have been struggling with their substance use, they probably haven't learned any coping skills outside of substance use.
How often is it that the patient themselves contacts you, or as opposed to a loved one or a family member reaching out? Do you see one more than the other? Are they the same?
I would say more often than not, it's the patient. We kind of require that though, because, I talk to a lot of parents who are really worried, or, husbands or wives or kids even, who are worried about their loved ones. And I kind of have to try to explain to them, I understand that you're worried and scared, but unless they want to come to treatment, it's probably not going to be helpful. You telling them they have to come in, or there will be a consequence, that just doesn't typically work, especially not long-term for people. So we do require that the individual themselves reach out to actually schedule the appointment and come in, because we want to see that there's some level of motivation on their side.
My favorite part of working here is that I get to take care of my friends, my family, and my community.
Gifford has been very supportive for me. They let me go get my education and I kept working.
There are things that are really supportive for families here. We have a daycare center on site. The people here are the best part about Gifford.
So a lot of times then I would imagine it's the family member or the loved ones encouraging, or the friends encouraging that person to reach out. And that can probably be a very delicate situation, I would imagine. So what tips, or maybe first let's talk about signs. What signs should people be looking out for people who they think might have a problem?
I think changes in behavior, kind of suspicious types of behavior. For people who are drinking, if they're drinking a lot more or trying to hide their alcohol use, that can sometimes be a sign. If they're drinking in situations that have higher risks, so they're drinking and driving a lot, but the changes in patterns, people who are drinking just to avoid going into withdrawal or using substances to avoid withdrawal, so it's that point where it's not really fun for them anymore. It's just a maintenance. Those can all be signs, but there's a pretty wide range of things, to look for and to see. So to me, it's kind of like, if you're concerned, it's always okay to call. And, I'm always happy to talk to people if I have time and, try to help them, navigate that, and how to have those conversations with people that they're worried about.
So if somebody does reach out to you, and you have this conversation, it's kind of decided that, yeah, I think there's something here. So then what is the next step? How do you go about such a situation like that? We can talk about the don'ts, but let's talk about first about what can you do when you do realize that, yeah, this person, that we care about needs some help.
Yeah. One thing I recommend to people too is that they get support for themselves first. Because again, you can't make someone want to get into treatment. And so if you're going to have to continue to deal with their behaviors, or if there's issues in the relationship, it's important that the individual gets help for themselves. I encourage people to kind of talk to their loved ones in a way that is, gentle and from a place of concern, as opposed to a place from anger or demanding. Sometimes just letting people know, I talked to this person on the phone and they were, they seemed pretty nice. Like, it might be okay to just call and talk to them. Giving them our phone number, giving them our website and saying, just look at what they have to offer and, check it out and see what you think. Or, also just telling people, I really love you and I care about you and I will help you find help when you're ready to get it. I think that's kind of the best that we can do as family members or loved ones who have people in our lives that are struggling.
And I know you're really passionate about letting those family members and friends, loved ones know about the resources that are out there. I think oftentimes we put all of the focus and attention on the patient, which is warranted, but you can kind of maybe, under the radar comes the family and the friends and how this affects them. So tell me a little bit about where that passion comes from for you, and what are some of those resources that are out there?
Again, that, part of that is just my own personal history, in terms of dealing with family members and loved ones that were struggling with addiction. I think because of my work, I've talked to family members a lot and heard their concerns, and, and I understand how that feels for them. And I know it's a really hard place to be in, because you really are pretty helpless in a lot of ways. So there are resources like Al-Anon. There's resources like the Turning Point Centers, which are all over Vermont, and they offer support groups for families. And I have to say, one of the good things that did come out of the pandemic is that a lot of those organizations are offering more Zoom meetings and online meetings. So, you don't necessarily have to be able to go somewhere to attend a meeting. And you can attend a meeting any time of day, because you could attend a meeting that's happening in California, late at night if you need to. So there's definitely a lot of support that's available for families that need it.
Are you learning more as you progress in this career? I mean, are there days where you're just constantly more things, or the more people you talk to, the more help you distribute? I mean, is this kind of a growing and learning process for you as well?
Oh, absolutely. Yeah. I mean, I think the more people I talk to, the better I understand, what they're going through. I've learned a lot about, so, people, my clients have taught me a lot of things. From when I first started, I had the assumption that no one used drugs in jail, and that's really not the case. So I've definitely learned a lot. And then the resources, and, that's one of the great things about working in Vermont is, I established a really great network in central Vermont, working with teams up there and connections to all the community supports. And now we have that here in Randolph. And so, there are community supports around. And again, I'm grateful for those, and then grateful for all of the supports and everything that we have right here at Gifford.
We talked about what to do, and I think you touched on a little bit about, not being confrontational, but what are some other things to avoid? Obviously the first and foremost is it's up to the person themselves to want to get the help.
Yeah. I mean, I think ultimatums don't tend to work. We see shows like Intervention, and I think sometimes people want to try to do something like that on their own, but things like that are actually, people get trained especially to be interventionists and do those types of things with people, because it has to be done in a really specific way. But I think it's also important for family members to learn to set boundaries, and, sometimes we have to tell ourselves, I can't give this person money anymore, or I'm not going to drive them to go and get more alcohol when they run out, because I'm sober and they're not. So I think it's really about kind of your own personal comfort level, and then also the safety of your loved ones and the safety of the people who are around them.
We talked a little earlier about treatment, and I know you referred a lot of that to Dr. Laconis. Can you go into a little bit more about treatment options, and what are some of the ways that you help?
Yeah, so there are medications available for alcohol use disorder. There's a couple of medications that can actually help reduce cravings for people who are trying not to drink or who are trying to drink less. Those medications can also help people to sometimes naturally drink less, because they reduce the pleasurable effects of the alcohol. There's medications like Antabuse, which a lot of people have heard of, which is the one that makes people really sick when they drink. Then we also offer the medications for opioid use disorder, Suboxone, which can help reduce cravings, but also fills up those opioid receptors so people don't go into withdrawal. And then there's medications like Vivitrol and Naltrexone that can also help in terms of reducing cravings for opioids. So, and most of those medications are done in conjunction with counseling. Sometimes there's people who don't, it's not always, a requirement of the program, but more often than not, the counseling goes with it as well.
Find out with pretty much, any issue, right? An eating disorder, there's always an underlying issue that's underneath. For you, when you are with and you hit that underlying issue and there's that moment of clarity, maybe that doesn't happen right away, maybe it happens over time, but tell me about that experience, and how when you're able to get to somebody and you get to the root of the problem, and there's that moment.
I mean, I think for me, it's a lot of it's validation for people, and sometimes just being able to normalize what they've experienced, and that their substance use is an expected outcome based on the experiences that they've had in their life. I think that provides a lot of relief for people, because they suddenly don't feel like there's something wrong with them or that they've done something wrong. This is an expected outcome based on the experiences that you've been through, and that it's a matter of learning new ways of coping and dealing with feelings. And so I think it's, it's validation, and then also giving people hope that there are different ways of managing difficult things.
Do you have a particular, without getting obviously into specifics, is there something, a particular story that either affected you or something where, there was that moment and it kind of changed things for that person, but for yourself as well? I mean, obviously, talk specifics, but, is there some sort of story you can share with something like that?
That's a tough one. I feel like I've had a good amount of those experiences. It's funny because I think the experience that I remember the most is from when I first started, and like my first client kind of duped me, and remember that feeling of, oh my gosh, I can't trust what anyone tells me anymore. And like, I really don't want to be that person because that's not who I am. And my supervisor at the time said, it's okay to trust people. It's okay to believe their stories, but you also have to take it with a grain of salt, So for me, it's been a big learning curve in terms of helping people, but then also learning how to try to not take on everything for them or fix things for people, So it's been a great experience helping people learn how to take care of themselves. And more often than not, the people that I'm working with figure everything out for themselves. I just sometimes point out what they've already said, or I can say it in a different way, where they said, like yesterday, I had someone who said, I'd never thought of it that way. All of this makes sense now. And this was someone who's been in therapy for like 10 years, and she was like, I never made sense to me before, and now it does. But all I did was say back what she had said in a slightly different way. So, I don't take credit for it. The people all do the work, and they're doing a lot of hard work. And I feel really fortunate to be able to be part of that journey with them.
And that must, and again, going back to what I had asked you before, and that must be like the moment of like, you know what, that moment is why I decided to take this career path.
Yeah. Seeing that moment when people, that light bulb goes off, or where they have that understanding and that moment of clarity, like that, those are the moments as a counselor that I live for, because they've done it and they've figured it out, but it makes such a difference, and it's awesome to be able to be part of that.
So April is National Alcohol Awareness Month. And if there was somebody, obviously something we should be aware of all year round, but we're putting the focus on it in the month of April. But if there's somebody out there who's watching this or listening to this, and they might be struggling themselves and haven't yet sought help, what advice would you give to that person?
I would say, give us a call. I'm always tell people, call and you can ask for me specifically, and I will be happy to make the time to talk to you. I know it's scary and I know it's intimidating, and we try to meet people where they're at. We don't have an agenda. It's our goal is not to necessarily get everyone who comes in the door to stop drinking alcohol forever. Someone comes in and their goal is they want to cut back by 50%. That's what we're going to work on. So I think knowing that people are really in control of what they're going to do when they come here to work with us is an important thing to know. Knowing that, neither Dr. Laconis nor I got into this business to judge people. We really, that's just not what we do. Neither of us like doing that. We want to help people, and we want to, do whatever we can to help them find the supports that they need. The other thing is that we have great resources in the community. We have the Turning Point centers, and we have recovery coaches. So if people aren't comfortable coming into the medical center, this kind of a medical setting and getting help, there's other resources out there, and we're happy to share those with people too. So, more often than not, if they can just call us, we can help them get in some direction where they can at least start the process if they're ready to start.
Do you feel that there's enough resources out there, at least within the state, to help folks? And I guess we could always have more, right? But are we adequate at this point?
We're doing better. I think especially in terms of the opioid use disorders, when I first started working, we had a wait list that was 3 years long. And now the state started a rapid access to medication program where people who want to get inducted onto Suboxone and meet the criteria can get on medication in less than 24 hours, no matter where they go. So, the access has increased, unfortunately, because the need has increased, especially with the pandemic for mental health and substance use therapies. It is difficult to get people in, a lot of, especially for people who are looking for individual counseling. That being said, I'm always taking new people. I haven't ever closed my list off to anybody. So, sometimes it's a couple of weeks, but, we can get people in, and Dr. Laconis has great availability too, in terms of getting people in. So we try to make sure that we can make it happen as quickly as possible. So I think we're doing pretty well. But like you said, there could always be more.
And I think, what prompted that question, 2014, there was that article, or the cover of and an article in the Rolling Stone with the lumberjack on the cover, the new face of heroin. Yeah. And I think that opened up a lot of people's eyes at that moment. And, you were working for the state at that time. So yeah. You were you saw that reaction to that. When that happened, where what was the reaction? And do you think since that moment, it's something that we have really shifted our attention to and been aggressive in meeting that challenge?
Yeah, I mean, I think we always knew it was a problem. We knew that we were not serving people in the way that we could. But again, for the programs that are, the hub and spoke program that Vermont has in terms of opioid treatment, we were going around to other states and showing them how they could start similar programs. So Vermont has been ahead of the curve in many ways. But I think we did realize that we need to step up our game a lot more, and even here at Gifford, we changed our intake process to try to streamline it so that when people call, they don't have to do a full phone intake. They don't have to jump through a bunch of hoops. They don't have to get us records. It's call us, we'll get you scheduled, and then we'll take it from there. And then again, with the rapid access to medication program, which I think started 2 to 4 years ago, maybe, that's made a huge difference. And that, we were part of the pilot program that was working out of Central Vermont Medical Center, and I think Burlington was also doing it at that time, and then Gifford joined in shortly after. So we got to be part of that whole pilot program as that started. So
how about the administrators here at Gifford wanting to have this resource, wanting this available to people? I know we talked about it way back in the beginning of this interview, but they started this program. Tell me how important it was for the administration, the folks here, to have this program grow and develop and be what it is.
Yeah, I mean, I think that the administration here has always, again, we're a small hospital and we're in a small community. And so I think it feels like family, and we know the people that we're working with. And so, I think Gifford kind of takes that approach of, our community is our family, and seeing this need for more treatment options for people in terms of addiction. They did what they needed to do to kind of get this program up and running and make it happen. And so I think we're super fortunate that we have an administration that recognized that and then created a program to deal with it.
After I left the military, I missed that feeling of belonging to something and feeling a part of something special. And that's exactly what I got when I came here at Gifford Medical Center.
Apply today. Go to giffordhealthcare.org/careers. You can read more about Jen Pelletier's background, her bio. You can read about Dr. Laconis and the rest of our psychiatry and counseling team by going on our website, giffordhealthcare.org. Go under services, look for psychiatry and counseling, and you'll have everything there you need to know. And where can people, we talked about calling you, what's the best way people can get in touch?
Yeah, the best way to reach us is our main phone number, which is 802-728-7744. leave us a message if someone doesn't answer, but usually somebody answers. If people want to call me directly, it's 802-728-7713. I will do my best to call people back as soon as possible. But yeah, we're happy to help, and we definitely want to support people. We also, just on a quick note too, we're a Narcan distribution site here. So if people are seeking to get free Narcan, if they're concerned about themselves or loved ones, we can also offer that here. No names necessary. So
How important was having Narcan here? I mean, to be able to provide that, because obviously that goes a long way too in treatment.
yeah, no, it's been great. And, we were able to offer it to people who are still actively using, and recommend that they take it home and have it with them. But we're also able to give it to family members and concerned loved ones, who just want to have it on hand just in case. So it's been great to be able to offer that to our clients, but just the community as a whole.
Well, Jen Pelletier, thanks so much for joining us on the podcast. I've learned a lot myself, and the more we discuss these topics, the more we discuss the services that Gifford provides and the folks that are offering those services. I mean, everybody's just so willing to go out of their way to help the community, and regardless of what the problem is. So I appreciate what you, Dr. Laconis, and the rest of the psychiatry and counseling team do. Any parting words for folks out there? I know we talked about, some advice if somebody is listening, but, as we are into Alcohol Awareness Month.
I think it just, it's okay to reach out and ask for help. Whether you think you have a problem or not, or if you're just questioning where you're at with your alcohol or substance use and you just want more information, don't hesitate to reach out for help, because really, we don't judge, and we're happy to help, and that's what we're here to do. So if there's any question, don't hesitate.
All right. Again, Jennifer Pelletier, thanks so much for joining us again on the podcast, the Gifford Provider Podcast. Thank you.
Thanks.